Hi, my name is Alexis Musick, and I am a third-year medical student at the Duke University School of Medicine.
My name is Sara Shilling, and I am a final year Master of Social Work student. We are both 2020-2021 North Carolina Albert Schweitzer Fellows. For our project, we aimed to impact adolescent mental health by partnering with UNC Children's Primary Care Clinic to create and lead a free positive parenting program for caregivers of 11 to 14-year-olds.
More specifically, Sara and I spearheaded the creation of Care, also known as the Adolescent Mental Health Parenting Program for Child-Adult Relationship Enhancement.
Care is a 6-week group-based parenting program. In 2-hour sessions each week, we discuss a wide variety of topics, including teen development, positive parenting techniques to connect with teens, signs and symptoms of common mental health disorders like depression and anxiety, and how to have conversations about mental health with teens.
So to do this, we spent months meeting with clinical experts across the nation, consulting scientific literature, and writing what eventually became a 119-page Care Facilitator Manual, complete with a 333-slide interactive virtual program and 45 handouts for caregivers. That said, just as it takes a village to raise a child, it took a village to create Care.
I'm Mary Catherine Penn. I'm a clinical social worker and therapist working with the Care team.
My name is Martha Perry. I am a board-certified adolescent medicine specialist.
My name is Dr. Samantha Shilling, and I am an assistant professor at UNC in the School of Medicine, and I'm also a pediatrician.
So far, we have recruited 25 families. We have enrolled 11 caregivers in 2 cohorts of Care, which Alexis, Mary Catherine, and myself co-lead, with plans to keep enrolling.
However, we'd be remiss in talking about Care with no mention of the context.
While many public health concerns have improved over the years, there has been, unfortunately, a steady increase in mental health disorders. In fact, there is an increasing number of adolescents in our country reporting they have contemplated or attempted suicide. This has dramatically worsened since the onset of the COVID pandemic.
It is paramount to include caregivers into teen mental health. All of us humans are interdependent, we're connected, which means that when we assume that the issue only resides within one individual, we're missing the multiple linkages that shape a life, including caregivers, the environment, the cultural place and time that we're in right now.
Kids don't come with a rule book or an instruction manual, and so the idea of helping parents kind of understand normal adolescent development and also kind of signs and symptoms of mental health problems is wonderful, and that doesn't exist. There has always been a dire need for a program like Care, and now more than ever we need this.
My hope is that Care can help parents recognize these opportunities for intervention early. With parents understanding their adolescents' brain development and normal behaviors that occur as part of adolescence achieving independence, they can better identify when mental health problems occur and also support adolescents in a way that encourages the adolescent engaged in the appropriate help and support.
With that in mind, the best way to highlight our community impact is by elevating the voices of our families.
I think the Care program, it helps us to look into small things that are very simple. Hey, take some time and listen to your teenager.
Amazing program. It gives you different resource, different perspective. It helps your relationship. It increases your knowledge. I think it builds a better relationship between your teenagers and you. So I think it gives you like the first step towards a healthy relationship.
Some of the things I learned about her brain, her development, what she may be thinking, or the reasons why she's acting a certain way, it's let me not react how I normally would react, I guess. I take a moment to like think before I speak or think before I text with her. And I think it helped a lot.
I wish this class was early fall, because I think had I been in this class early fall, we wouldn't have ended up in the psych ER, which I do not recommend for anybody unless it's absolutely required, because it was not a good space. We had AMP Care before, and learning the tools and really being able to talk a little bit more about, suicidality then. I think we could have chosen a different path, but at the time I was just lost and scared.
I feel like we were able to have a good conversation about it with our daughter, to make it, not such a taboo subject, that kind of thing, that we could have, hopefully that, she can come to us if she's feeling, depressed and down, or, any other kind of feelings like that. Or that if she doesn't want to come to us, it's okay to speak to somebody else. And, we are happy to help, line that up, and that's totally fine. And, people need to do that sometimes, and that's okay.
We are so excited to further the impact that AMP Care has had by making it a permanent part of UNC Children's Pediatric Clinic.
We'd like to acknowledge our wonderful clinical team, Dr. Samantha Shilling, Dr. Martha Perry, and Mary Catherine Penn, and our additional mentors like the North Carolina Schweitzer team for their endless guidance and support. Perhaps most importantly, though, we'd like to thank our parents who inspired us and forever shaped our program. Thank you.